Welcome to our discussion on making invisible illnesses visible. We will explore infection-associated chronic conditions, focusing on long COVID, myalgic encephalomyelitis, chronic fatigue syndrome, and Lyme disease, as detailed in Clinical Infectious Diseases by Iskander and Herodopoulos, 2026. Millions of Americans suffer from infection-associated chronic conditions, often dismissed as invisible illnesses. Long COVID affects 18 million United States adults. ME/CFS impacts 2.5 million, with an annual economic burden of $24 billion, and Lyme disease sees 500,000 new infections yearly. These patients need recognition and effective treatment. Under the IACCI umbrella, we find three conditions: long COVID, myalgic encephalomyelitis/chronic fatigue syndrome, and Lyme disease IACCI. Long COVID affects 18 million United States adults with symptoms lasting over 3 months. Myalgic encephalomyelitis/chronic fatigue syndrome involves post-infectious immune responses causing fatigue and cognitive issues. Lyme disease IACCI is recognized for persistent symptoms post-treatment. A 40-year-old hiker from Maryland experienced tick exposure without a rash, leading to a delayed Lyme disease diagnosis. Initial symptoms included fatigue, headaches, and joint pain. Despite treatment with doxycycline, persistent symptoms like fatigue and brain fog remained, culminating in a diagnosis of post-treatment Lyme disease syndrome, with no ongoing infection detected. IACCI conditions like PCC, ME/CFS, and Lyme disease share symptoms such as cognitive deficits, fatigue, and chronic pain. These include brain fog, unrefreshing fatigue, and diffuse musculoskeletal pain. The shared pathophysiology involves dysregulation across the central nervous system, autonomic nervous system, immune system, cardiovascular system, and gut microbiome, necessitating a unified clinical approach. Clinicians must prioritize patient-centered care for IACCI, focusing on symptom relief and quality of life. Validate patient experiences to avoid stigmatization, create a welcoming environment with longer appointments, and engage multidisciplinary teams. Manage chronic pain according to professional guidelines, such as the Centers for Disease Control and Prevention's 2022 Opioid Prescribing Guidance. Centers for Medicare and Medicaid Services Code G2211, introduced in 2024, is a new reimbursement tool for comprehensive care management of complex chronic conditions, including International Association for Chronic Conditions Initiative. It applies to primary care and infectious disease physicians, supporting ongoing management. Centers for Medicare and Medicaid Services proposed rules aim for fairer reimbursement and creating International Classification of Diseases, 10th revision, clinical modification codes for Lyme disease, International Association for Chronic Conditions Initiative, could benefit clinicians and researchers. 5 randomized trials show no benefit from prolonged antibiotics for Lyme disease IACCI, with significant harms like sepsis and antimicrobial resistance. Investigate autoimmune phenomena, immune dysregulation, and gut dysbiosis. Urgently needed are targeted therapies and symptom-focused treatments due to patients' functional limitations. Sustained funding is crucial for IACCI research. The RECOVER program allocates $132.4 million annually through fiscal year 2029 for multidisciplinary studies. The LymeX partnership, with $10 million in funding, focuses on new diagnostics. Patient communities must be integral to advisory and oversight roles, ensuring their inclusion in research processes. Strengthening surveillance and research design is crucial. Develop specific case definitions for Lyme IACCI, leveraging electronic health records for tracking. Differentiate surveillance from clinical diagnostics. Ensure inclusive trial designs, not excluding myalgic encephalomyelitis, chronic fatigue syndrome patients without documented infections. Employ basket trials for IACCI subpopulations and rigorously test complementary therapies. Harmonize research efforts and focus on symptom-driven, biomarker-guided care. Access evidence-informed guidance for immediate clinical action, even without a confirmed diagnosis. Utilize the Centers for Disease Control and Prevention Lyme Disease Toolkit for practical resources, Mayo Clinic's Essentials for Myalgic Encephalomyelitis Chronic Fatigue Syndrome Management, and Cohen Center's Resources for Chronic Illness Recovery. Additionally, Refer to Centers for Disease Control and Prevention's long COVID clinical guidance for managing post-COVID conditions. Over 20 million Americans are affected by IACCI, necessitating urgent, coordinated action. Clinicians should validate patients and manage symptoms. Researchers must explore shared mechanisms and develop targeted therapies. Policymakers need to sustain funding and build robust surveillance infrastructure. Coordinated efforts can bridge gaps and improve outcomes for individuals with IACCI.